Hi everyone, my name is Nikkolas, and today I'll be presenting my research on cardiovascular disease awareness among Albanian youth. This project focused on understanding how a short educational intervention can improve health literacy, correct misconceptions, and empower young people to take an active role in preventing one of the leading causes of death. Cardiovascular disease stands as a leading cause of death globally, taking nearly 80 million lives each year and accounting for about a third of deaths worldwide. Beyond its staggering mortality rate, CVD imposes a heavy social and economic burden, particularly on countries with limited healthcare resources. The disease is largely preventable through early interventions, lifestyle modification, and improved public health awareness. Targeting young population with education and prevention programs is essential to building a long-term resilience and reducing future. In 2019, cardiovascular disease accounted for roughly 285 million dailies across G20 plus countries, with the highest burden in China, India, and Russia, and the lowest Australia, Canada, and Korea. Overall, 46% of CVD dailies came from ischemic heart disease, 37% from stroke, and 5% from hypertensive heart disease, with India, China, and Indonesia contributing heavily to each category. Here's a graphic which shows what I just said. The primary goal for the month was to increase cardiovascular health awareness among Albanian youth by implementing a short focus intervention. A one-week virtual health education program was organized with 35 high school students between the ages 16 to 18 in Tirana, aiming to strengthen their understanding of cardiovascular disease, risk factors, symptoms, and gender-specific vulnerabilities. The intervention achieved measurable improvements in knowledge and perception. Average test scores rose significantly from 6.1 to 10.4 out of 12, demonstrating a substantial gain in understanding of CVD. Cardiovascular disease is the leading cause of death in Albania, responsible for more than 14,000 deaths annually, over 52% of total mortality. This rate significantly exceeds the European average of 38%. Despite the alarming burden, youth awareness of CVD risk factors remains undeveloped, leaving prevention opportunities largely untapped. Risk behaviors such as smoking, poor diet, and inactivity often take root in adolescence, creating a long-term vulnerability. Misconceptions persist, particularly the belief that CVD primarily affects older men, which leaves young people and women overlooked. Addressing this misconception early can shift trajectories and the aim of this research was to evaluate whether a brief, structured intervention could enhance cardiovascular health literacy among Albanian adolescents, empower them as agents of change, and highlight a scalable model of community development. The study employed a mixed method design, integrating a quantitative and qualitative approaches to provide a comprehensive understanding of the intervention impact. This design allowed for both measurable outcomes and in-depth insights, ensuring that changes in knowledge, attitudes, and behavior were captured. A pre- and post-test evaluation was conducted to assess the participants' immediate knowledge gains about cardiovascular disease. The structured 12-item questionnaire measured understanding of CVD risk factors, symptoms, and gender-related differences, providing statistical evidence of intervention effectiveness in improving health literacy among youth. In addition to the test results, participant reflection and open-ended responses were analyzed to explore shifts in perception and motivation. The qualitative data helped uncover how students internalize the information, correct misconceptions, and develop intentions to adopt healthier behaviors, offering deeper concept to quantitative. So firstly, I designed the virtual program and recruited participants through the teacher recommendation and classroom announcement. Then I selected 35 high school students between the ages 16 to 18 from Tirana, ensuring gender and socioeconomic diversity. I did the implementation where I conducted a visual CVD health education intervention in July 2025, and evaluation where 31 students completed the baseline and follow-up assignments, providing data and measured program effectiveness. At the end of the session, a digital handout summarizing key messages was distributed to reinforce learning. This source was designed to ensure peer-to-peer knowledge sharing, allowing students to spread awareness beyond the session and apply what they learn in daily life. Pre- and post-test intervention design. The study utilized the pre-test and post-test designed to evaluate the effectiveness of educational intervention. Each participant completed an identical 12-item questionnaire, both and before and after the session. This approach allowed for direct comparison of students' knowledge levels. The questionnaire evaluated students' understanding of 1. CVD risk factors, such as smoking, poor diet, lack of exercises. 2. Common symptoms such as chest pain, shortness of breath. And 3. Gender-specific vulnerabilities, highlighting how heart disease can manifest differently in a man. A paired sample t-test was conducted to statistically compare pre- and post-test scores. This analysis determined whether the intervention led to significant knowledge improvement among the other participants. The post-test included an open-ended question asking students to reflect on what they learned and how they are planning to apply or share their ideas with other peers. The question invited the participant to describe what they learned about cardiovascular health and how they intend to apply or share that knowledge in daily lives. The reflective element captured in the depth and personal meaning of the educational experience, offering insights that quantitative scores alone could not reveal. Qualitative responses were examined through thematic analysis, revealing common themes related to behavioral intentions, such as adopting heart health habits, and advocacy potentials, such, for example, spreading awareness among. So the result. The intervention demonstrated measurable improvements in cardiovascular health literacy among participant students. Out of 35 students, 31 completed both the pre- and post-test assessments, allowing for robust quantitative comparison. Overall, the results showed statistically significant knowledge gains and meaningful qualitative shifts in perception and intention to act. These findings confirm that even a short, low-cost educational session can generate immediate impact and foster community discussion effects. Qualitative outcomes and discussion effect. Awareness of early CVD risk. Students realize that CVD disease can affect people at a young age, not just older adults. This early awareness helped them understand the importance of monitoring their own health from an early stage. As a result, many became more attentive to potential risk factors and motivated to take correcting gender misconceptions. Many students initially believed that heart disease primarily affects men. The intervention clarified that women are also at significant risk for CVD. This new understanding helped correct misconceptions and encouraged students to consider heart health for everyone. Commitment to lifestyle changes. After learning about CVD risk, students expressed intention to improve their diet and increase physical activity. They also recognize the importance of adopting consistent, healthy daily routines to reduce long-term risks. Overall, participants showed motivation to make tangible changes to protect their cardiovascular. Peer-to-peer knowledge sharing. So students plan to share the information, what they learned, with their family members, helping raise awareness at home. They also aim to educate classmates, creating a ripple effect of knowledge throughout their community. This peer-to-peer approach highlighted the potential for short educational interventions to foster broader to community. Here are some of my references where I was based off doing my research. Thank you for listening to me, and thank you for this great opportunity.